Cryptic pregnancy. A cryptic pregnancy, also known as a stealth pregnancy, is when a woman doesn't know she's pregnant. Perhaps conventional testing methods fail to detect the pregnancy, or she doesn't notice she is experiencing symptoms of early pregnancy. Research estimates 1 out of 475 pregnancies may go undetected or unnoticed until she's about 20 weeks pregnant. 1 is 2,500 stealth pregnancies aren't recognized until she goes into labor. Doctors classify most cryptic, or denied, pregnancies as affective, psychotic, and pervasive. 1. Affective. People with affective denial of pregnancy acknowledge they are pregnant, but do not prepare emotionally or physically for pregnancy, childbirth, and parenting. 2. Psychotic. People with psychotic denial of pregnancy may have mental illnesses, such as schizophrenia or bipolar disorder. They may experience symptoms of pregnancy but may link them to delusional causes. 3. Pervasive. People with pervasive denial of pregnancy experience a lack of emotional significance to pregnancy and are unaware that they are pregnant. They may also become aware of pregnancy late and avoid seeking medical attention. Causes of cryptic pregnancy. There is no clear indicator of cryptic pregnancy. Researchers previously thought that women with cryptic pregnancies typically had one or more of the following factors. 1. Younger age. 2. Learning disabilities. 3. Poor social and family support. 4. Mental illnesses. 5. History of drug use. However, researchers are yet to define clear causes of cryptic pregnancy. How can you be pregnant and not know? For many women who have had children, it's almost impossible to believe another woman can be pregnant and not know. The many not-so-pleasant symptoms, lack of periods, and weight gain are usually dead giveaways that your body is creating new life. If you're one of the rare few, though, it's possible to go through pregnancy and not know you're having a baby. This can sometimes leave doctors as confused as you are, but there are several medical explanations for how cryptic pregnancies can happen. 1. Birth control. If you take birth control or use contraception strictly and accurately, you might not think you may be pregnant. Contraception. As far as contraception has come in modern times, it's still not always 100% foolproof. Some types of birth control allow you to skip periods, which can make it even more difficult to know you're pregnant. You don't have regular periods. One of the first and biggest signs of pregnancy for many women is a missed period. 2. Periods don't always arrive like clockwork. If you are under a lot of stress, taking certain medications, or have other health issues like polycystic ovarian syndrome, PCOS, missing a period might not raise the same red flags. 3. Bleeding or intermittent spotting. In early pregnancy, implantation bleeding can happen about 2 weeks after conception when your future baby attaches to the side of your uterus. This bleeding can sometimes be mistaken for a period, especially for women that don't bleed heavily. Even in a healthy pregnancy, some women will continue to have intermittent spotting and bleeding throughout pregnancy. This could also be mistaken for light periods. 4. Pregnancy test. Most home pregnancy test brands proudly advertise their high accuracy rates, but that doesn't mean they're never wrong. The tests work by detecting certain levels of human chorionic gonadotropin, HCG, in your urine. It's possible to get a false negative result. If you don't follow the directions accurately or you take the test too early, you might not have enough HCG built up to get a positive result. Why might a pregnancy test give a false negative? If a person follows the directions of an at-home urine pregnancy test correctly, the results are typically reliable. Other situations may cause a false negative result. This means people are pregnant, but the test gave a negative result. Factors that can cause a false negative result include: A. Taking the test too early. B. Using diluted urine for a pregnancy test. C. Checking test results too soon. Certain medications can also affect the results of a pregnancy test, causing a false positive result. This means the test shows positive for pregnancy when a woman is not pregnant. Medications that affect pregnancy test results include promethazine, Parkinson's disease drugs, anti-anxiety medications, antipsychotic medications, diuretics, anticonvulsants, fertility medications. Pregnancy tests. Some brands of pregnancy tests are less reliable than others and their sensitivities may vary from test to test. The packaging of the at-home urine pregnancy test should indicate the test's sensitivity. If someone believes she is pregnant, but the urine test is negative, they should test her urine again in a few days. If the test is still negative, they should speak with the doctor and request a blood test. 5. Lack of typical pregnancy signs or symptoms. Many women have a variety of telltale pregnancy symptoms starting very soon after conception. If you don't have any of the normal early symptoms like cramping, nausea, vomiting, or breast tenderness, it's possible not to know you're pregnant. Even if you have mild morning sickness, you might simply write it off as a stomach bug or other temporary illness. 6. No weight gain or pronounced baby bump. No two bodies are alike, and each woman will carry her weight differently. If you are a larger woman or you don't gain a lot of weight as your pregnancy progresses, you might not know you're pregnant. The same is true if you started dieting or working out early on during your pregnancy, you might lose weight instead of gain it. 7. No feel of baby movement. If your baby isn't very active, you might not feel much fetal movement. An anterior placenta, or one that grows in the front of your uterus across your belly, might also make it more difficult to feel movement. You have dealt with infertility or were told you can't have children. Women who have had difficulty becoming pregnant in the past, or have health conditions that cause infertility might not believe that they are pregnant. Older women might also think they're unable to get pregnant anymore or confuse pregnancy symptoms with the signs of menopause. 8. Inconclusive ultrasound. Even an ultrasound can fail to find a growing fetus if it's not looking in the right place. If a person with cryptic pregnancy has approved to get an ultrasound despite a negative pregnancy test, it's possible it won't show up in the first trimester due to the way one's uterus is shaped, an error on the part of the ultrasound machine, an irregularity in where the embryo is implanted. 9. Lack of belief. Stress, fear, and shame can play a role in accepting or acknowledging pregnancy. If your pregnancy comes during a difficult time, you might not be aware. Denial. Denial can be powerful. Some women who are unexpectedly pregnant might simply refuse to consider it a possibility. What are cryptic pregnancy symptoms? Cryptic pregnancies are often defined by their complete lack of typical pregnancy signs and symptoms. Some women legitimately do not experience any symptoms. Some others might have had mild pregnancy symptoms that they wrote off as something else. If there is a possibility you could be pregnant, there are many typical signs that you should look for and know. Some common symptoms you shouldn't ignore include missed periods, sore or swollen breasts, spotting, nausea or vomiting, fatigue, bloating, cramping, constipation, frequent urination, congestion, sudden food aversions or cravings. Who is likely to have a cryptic pregnancy? 1. Women who recently gave birth. Even if she just had a baby, it's possible for ovulation to restart sooner than she expected. She's probably not expecting her period yet, so she may assume any weight gain or abdominal swelling are from the previous pregnancy. 2. Polycystic ovary syndrome, PCOS. If they've been diagnosed with PCOS or infertility, they won't think they're pregnant now. 3. Birth control use. Birth control isn't always foolproof. Even when used correctly, it's possible to become pregnant. Those who use birth control may assume they're safe and ignore pregnancy symptoms. 4. Perimenopause. Women in their late 30s or early 40s could mistake pregnancy symptoms with early menopause. They might also think that their chances of conceiving are lower because of their age. What are complications of a cryptic pregnancy? Complications of a cryptic pregnancy are a direct result of not knowing you're pregnant. Some of those complications are: 1. No pregnancy care. Since you don't know you're pregnant, you haven't been seeing a provider for your prenatal care. This means you didn't have the necessary blood work, nutritional counseling, ultrasounds or other support you need for a healthy pregnancy. Not knowing you're pregnant could also mean going into labor on your own without help from a skilled healthcare provider. 2. Lifestyle adjustments. Smoking cigarettes and drinking alcohol are harmful during pregnancy. Since you don't know you're pregnant, you may use these substances or take other medications and supplements that are generally unsafe for pregnant people. 3. Higher risk of medical conditions. You won't receive the care or tests necessary to diagnose certain conditions like gestational diabetes or preeclampsia. 4. Higher risk of congenital conditions. The fetus is at risk for congenital conditions because you didn't receive genetic tests or other evaluations that help diagnose birth disorders. Studies also show infants born from cryptic pregnancy are more likely to be born premature, which puts them at risk for poor growth or respiratory issues. Do you get your period in a cryptic pregnancy? No. A cryptic pregnancy is similar to a regular pregnancy in that you don't get a true menstrual period. However, you may experience implantation bleeding or abnormal pregnancy bleeding and think it's your period. How does it affect labor? People with denied pregnancy may deliver unexpectedly, in some cases, giving birth without assistance. Unassisted deliveries can be dangerous for both the pregnant person and their baby. According to the American College of Obstetricians and Gynecologists, there is around a twofold increase in the risk of perinatal death when giving birth at home. However, the rate still remains low, at around 1 to 2 in every 1,000 births. The best way to prevent a stealth pregnancy is to be aware of your body and sexual health. If you believe there's any chance you could be pregnant, it's always best to take a home pregnancy test or visit your doctor for a blood or urine test. Anyone experiencing pregnancy symptoms should consult with a doctor to confirm the diagnosis or provide emergency care if necessary. The sooner a person confirms pregnancy and begins receiving appropriate care, the higher the chances of a successful pregnancy. If you are sexually active and are experiencing symptoms unusual for you, like weight gain, breast tenderness, missed period, take a pregnancy test or consult your healthcare provider. By taking care of your health, you can better ensure the health of your baby.